The vast majority of our daily cases continue to be migrant workers residing in the dormitories. As we systematically clear the workers and the dormitories, we expect the number to remain high over the coming weeks before gradually declining as we complete the clearance. My co-chair, Minister Lawrence Wong, will provide more details on our progress in clearing the dormitories shortly. Let me just talk about the community cases. Since the lifting of the circuit breaker some 1.5 months ago, the number of community cases has increased but continued to remain low, at about an average of 12 per day. In the past week, this is similar to the number in the first week of July. It will be useful for us to take a closer look at these community cases to better understand the underlying trends. Firstly, around half of the community cases over the last 2 weeks are linked, and most were detected as a result of contact tracing or proactive screening. We are always more concerned about the unlinked cases. About 7 in 10 of the unlinked cases were asymptomatic, and almost half are likely to be past infections as they are tested positive when we ran serology tests on them. They would probably not have been detected if not for our proactive screening approach, as they are asymptomatic. This means that they are unlikely to see a doctor because they are generally well, and they would not have been picked up otherwise. Therefore, the number of cases we see is actually somewhat dependent on our screening approach. Furthermore, amongst these unlinked community cases, we continue to see a large proportion linked to the construction and related sectors. They are classified as unlinked because we cannot identify the specific individual or cluster that passed the infection to them, but they appear to be linked broadly to the construction and related sectors. As I shared last week, we are keeping an especially close watch on the symptomatic unlinked cases that are detected in the community through our routine screening for acute respiratory infections, or ARIs. If these cases start rising, it could be an early signal to us that there may be an increase in the underlying transmission in the community. To detect these cases early, from 1st July, we have been testing all individuals aged 13 and above who are diagnosed with ARI symptoms at first presentation to a doctor. This allows us to detect infected individuals early and to quickly contain them and prevent further spread. We are now testing on average about 2,400 ARI cases a day. Even with this rigorous testing, the number of unlinked COVID-19 cases detected through this ARI screening in the community has remained stable and continues to be in the low single digits. This suggests that the prevalence in the community remains low. But this is not the time to celebrate and be complacent. We are certainly not out of the woods yet. Globally, there are now more than 13 million people reported COVID-19 cases and more than 500,000 deaths associated with COVID-19. Many countries, such as the United States and Brazil, are still reporting surges in case numbers with no signs of slowing down yet. The World Health Organization has recently warned that the situation would get worse unless there is collective effort to control the transmission of the virus. While some countries, including China and New Zealand, have largely managed to bring the outbreak under control, several others are experiencing a resurgence of cases a few weeks after lifting their strict social distancing measures. Some regions have had to reintroduce restrictions in an attempt to bring the transmission under control. Let me show you a chart just quickly. We must be prepared for a second wave too, but we must do our best to avoid it if we can. There are useful lessons we can glean from their experience to avoid a similar scenario in Singapore. The Ministry of Health has reviewed these case studies and found that in many countries or regions where there had been a resurgence of cases, it was because safe management and safe distancing measures had not been adhered to. As you can see from the chart, many countries are seeing a second wave confronting them. From these cases, we have found that some had gone out when they are unwell and mingled in settings where many people had congregated. These include religious events, parties, and large family gatherings. In South Korea, for example, door-to-door sales resulted in 4 clusters with over 200 infected cases. And religious gatherings there resulted in more than 110 confirmed cases recently. In Tokyo, Japan, more than 300 cases have been linked to nightlife establishments. In Victoria, Australia, large school clusters have been spawned as students did not practice social distancing and participated in non-school related social gatherings outside. In Hong Kong, there have been outbreaks at restaurants and cafes as patrons did not put on their masks after they have completed their meals. In many regions, lapses in workplace safe management measures, including workers not wearing masks, have resulted in large clusters too. I know many Singaporeans and organizations are keen for more flexibility and further relaxation. But from these examples, we know there are settings and activities that are more susceptible to transmission, where there is close and prolonged contact among individuals. These include workplaces, religious gatherings, as well as nightlife establishments. That is why in Singapore, we have taken a cautious approach in easing restrictions for some activities that we know to be of higher risk. For others that need to continue to function, like workplaces, we have put in place a series of measures to reduce the risk of spread at these settings. Some of these measures create inconvenience, but it is better to be safe. Still, with a significant expansion of economic activities and social interactions since phase 2 started, we should expect to see the number of cases rise. What is important is to detect these cases early and ring-fence them to prevent further transmissions and the formation of large clusters. The second wave is preventable if everyone plays our part. And I believe that if anyone can do it, Singaporeans can. Thank you. I'd now like to invite my Director of Medical Services, Professor Kenneth Mak, to give an update on the medical situation here.
Thank you very much, Minister. As of today, the 17th of July 2020, the Ministry of Health has preliminarily confirmed an additional 327 cases of COVID-19 infection in Singapore. As Minister has mentioned, the vast majority of these cases are work permit holders who reside in foreign worker dormitories. Based on our investigation so far, there are 9 cases in the community, of whom 6 are Singaporeans or permanent residents, 3 are work pass holders. In addition, there were 3 imported cases who had been placed on stay-home notice upon arrival and who were tested positive while they were serving their stay-home notice. We are still working through the details of these cases, and further information will be provided through the press release that was issued, that will be issued later tonight. Minister has also mentioned about the presence of community cases that we have seen over the last few weeks. While we have identified about half of these cases to be close contacts of previous cases and had already been quarantined, we have also noticed that there were a number of transmissions occurring from the workplace, and clusters had arisen from some cases infected through the course of work and who had in turn infected household members. We continue to be aggressive about chasing these active clusters. We take aggressive public health measures to ring-fence and isolate all close contacts in order to disrupt any potential onward transmission. The number of community unlinked cases remains a focus of our attention, and many of the unlinked cases are identified, as Minister has mentioned, through routine, regular testing of frontline workers and those in the construction, marine, and process sectors. They are quickly identified and isolated. We perform close contact tracing of close contacts in order to quickly identify those that need to be quarantined. And a testament to the fact that we are able to throw a net quickly around these close contacts is evidenced by the fact that our interval between the date of onset of symptoms to isolation continues to decrease for all our community cases. And we are able, on average, to isolate community-linked cases within a day, if not 2 days. So that allows us to be effective for throwing a net wide. We had in the previous press conference also updated about our contact tracing and screening efforts based on a cluster of cases in a housing block in Tampines Street 11. 152 residents and 25 visitors had been contacted when we screened 57 households. 123 persons had taken up our offer to undergo PCR testing, and I was pleased to note that all had negative results. The residents and visitors remain under phone surveillance, and we want to confirm and ensure that they remain well. We continue to perform surveillance testing in the community, as the Minister has shared, and indeed, we have seen those numbers come down very steadily since we've moved into phase 2. In the preceding period between the 8th to 10th of July, for example, out of 4,191 samples collected from ARI cases, only 1 case was picked up, and that continues to confirm our belief that the incidence of community unlinked cases, cryptic infections, remains low. When we look at various indicators like the reproduction number to identify how cases are transmitting in the community, that has been consistently well below 0.5, which continues to be a testament to our aggressive attempts to isolate and ring fence. We note that the number of imported cases has risen in the last 2 weeks. The Minister has alluded to that. A number of the imported cases come from the Indian and South Asian subcontinent. Many were Singapore citizens or permanent residents returning to the country. These cases were all placed on SHN, isolated immediately on arrival, and tested while on SHN, and there has not been any risk to the community as yet. But because of the high incidence of cases in these various countries, we continue to watch the situation carefully and continue to be vigilant about the risk of transmission to the community from imported cases. Thank you.
Good evening. I'll give you an update on some of the work that's happening with regard to the clearance of workers and dormitories. We are in the final stretch of this clearance work. Thus far, we've used a combination of different techniques, including serology tests and PCR tests to clear the workers, and we've been making good progress. So in this final stretch, well, I should say that up to now, we have around 230,000 workers. 230,000 workers have either recovered or have been tested to be free from the virus. These are workers in the dormitories, be it purpose-built dormitories or factory-converted dormitories. Altogether, we're dealing with about 300 over 1,000, so we have made good progress in clearing 230,000 of them. The remaining workers that we are looking at, most of them have been, all of them have been isolated. In fact, they are mostly waiting for their final exit test, as it were, to be tested at the end of isolation, and then we decide whether they are negative, or if they are positive, we send them, we provide the necessary treatment for them. So in this final phase, many of the workers have come from dormitories with higher prevalence, and so in this final phase, as we clear through this last group of workers, we are finding more of them to be tested positive at the tail end or at the final test. And that's why you've seen some increase in the COVID cases from the dormitories in recent days, including today. We expect this trend to continue over the coming days, but the main point is we are completing the clearance of all the workers in the dormitories quite soon. We believe that by mid-August we can complete this work, possibly even earlier than that. So we are doing everything we can to complete that work and to allow the workers to resume work safely thereafter. So this is an important milestone, the fact that after the clusters in the dormitories flared up, we've had to manage, contain, and control the flare-up in the clusters, but now we are reaching the final stretch and are able very soon to complete the clearance of all the workers, all the dormitories, and eventually have these workers back at work. The second front that we have to deal with, besides the dormitories, after we've done the work on the dormitories, the second front that we have to deal with and to be very vigilant on, besides dormitories and community, is imported cases, as we had to in the past. Because as you heard just now, the external environment remains one where the virus is spreading quickly, and even in countries that had controlled the virus successfully before, they are now seeing a resurgence of cases. So the cases from overseas coming in through our borders represent another risk for us, even as we clear the dormitory cases. And therefore, we are monitoring the situation very carefully. Our overall advisory remains for everyone in Singapore not to travel, to avoid all travel. That remains the overall posture for now. At the same time, we are assessing the situation in various countries. Earlier, a few weeks back, we had adjusted our border measures to allow travelers with recent travel history in certain areas where we assessed the virus to be under control. When these travelers enter Singapore, we allowed them to serve their 14-day isolation period at home in their place of residence, instead in place of a dedicated facility. In other words, they serve their stay-home notices at home instead of a hotel. That was a move we made earlier. But we have updated our assessments based on the latest situation. And given the resurgence of cases in various places, we have decided to change the advice or the requirements for travelers with recent travel history, including transit to Australia, the state of Victoria of Australia, Japan, and Hong Kong. Travelers with recent travel history or transit in these areas will now be required to serve their stay-home notices at dedicated facilities instead of their own place of residence. And this will apply to all travelers with recent travel history in these three areas entering Singapore after 19th of July 2359. So this is the change we are making. Again, it's, I think, not something new because, as we have repeatedly emphasized, our border measures are not static, they are not cast in stone, and we are constantly reviewing, updating them based on our assessment of the viral situation around the world in different countries. So this is one move that we are making now, and we may well make further moves as we assess the situation. The long and short of it is the fight against COVID-19 is not over. We've said that repeatedly. And again, it bears emphasis. This is a long fight for the world as it is for Singapore. And you can see around the world now, the number of cases globally continues to rise. It's not plateauing. It is rising. In some countries, you're seeing resurgence. In some countries, it has not even been controlled at all, and the cases are still accelerating. So we really need to remain vigilant both at our borders in terms of the measures we have in place at our borders, as well as within our community to continue to ensure that we control the infection and control the spread of the virus within our community. And we need everyone to cooperate and do their part in terms of individual actions and social responsibility too. And if we do all that, we have a good chance of continuing to keep COVID-19 under control while we progressively reopen our economy and our society. Thank you.
Thank you. I now welcome questions from the journalists.
Thank you, Ministers and DMS. We will now start the Q&A. Please use the raise hand function on Zoom if you want to ask a question. Before asking your question, please state your name and organization. We will unmute you before you ask your question and mute you thereafter. Please be reminded that you should only ask one question each time in order for us to accommodate more questions from everyone. Please also wait until you are spotlighted before you ask your question. May we have the first question from Audrey from ST, please?
Hi, thank you for the presentation and the updates. My question is about the foreign worker dormitories and the cases there. Can I just check with the task force about, since it has been about 4 months since the workers there were started to be isolated, so would the ministry be able to update about why it took so long for all the foreign workers there to be tested? And also, Minister, you mentioned earlier that the dormitories at the tail end of the testing procedure have a higher prevalence. So why is this the case, and why were they only picked up at the tail end of the testing process? Thank you.
I'll start first perhaps by answering the last question that you had, Audrey. It's not that we are now finding that dorms have higher prevalence compared to before in a belated fashion. In fact, as part of the strategy for clearing dormitories, we found that it was easier to clear the dormitories with lower prevalence, and therefore that was a priority for the interagency task force. However, now that we've cleared quite a number of the migrant workers living in these dormitories, we're now coming to the dormitories with higher prevalence, and they take a little bit longer to clear the entire worker population within these dormitories. And therefore, this final stretch will take a little bit more time for some of these dormitories compared to the dormitories that were tested as a priority in the beginning with lower prevalence. So that's not to say that we're only belatedly finding higher prevalence in some of these dormitories. In fact, we were already aware that the prevalence might be higher in some dormitories, but it was easier to clear those with lower prevalence much earlier, and therefore those were prioritized in the overall clearance strategy. It takes time for 300,000 workers to be cleared. It is not easy to do so in some of the dormitories because of the design of the dormitories. We have to take that into account as well. There's a need for isolating workers during a clearance process to make sure that those who are infected do not then continue to circulate and infect others within the workers. And therefore, that careful, calibrated approach towards clearing the dormitories to prevent further dissemination of infection during the clearance strategy, what has led to a much longer, more paced out strategy and approach that the interagency task force has taken. They've used a variety of different testing strategies to do so, and what is important as a priority for the task force is to make sure that once a worker is cleared, a dorm is cleared, the blocks are cleared, that we also make sure that we put the control mechanisms and measures in place to prevent reinfections, or those who are cleared not to have infection, that we continue to protect them, and so that their risk of getting infections is well mitigated. So that requires quite a bit of deliberate thought and planning and strategy, and it's led to a much more drawn-out process.
I would just to add that I think we've tried to elaborate or explain the scale of the operations that's needed to go in to control initially the spread of the infection across all dormitories, be it purpose-built dormitories or factory-converted dormitories covering 300,000 workers, is really quite enormous. And those of you who have been covering this from the start know the massive efforts that have gone in by thousands of frontline officers to, initially decant the workers from the dormitory sites to decanted sites, and then to put in place safe management measures within the dormitories, and then to look after the well-being and welfare of the workers. All that helped to slow down the spread of the virus within the dormitories. But you have to keep the workers in situ because you don't know whether they are cleared or not yet. And then after you have controlled the spread of the virus, you begin a process of systematically, block by block, clearing each block of workers. And even when you do that, it's not a simple process of do one-time test, because each time you do a test, you get a group of workers who are tested. If everyone tests negative, then not so bad. If you know that the entire block is clear, but this has not happened, right? Neither has it been the case that everyone tests positive, because the safe distancing measures do help to slow down the spread of the virus. But at the same, that also means that every time you go into a block, you end up with a certain percentage that are positive, a certain percentage who are test negative. And then when you have to deal with that, you have to restart sometimes the process of isolating the workers, another 14 days of isolation, and then it repeats block after block after block across multiple dormitories, across 300,000 workers. It is quite a massive undertaking, and to be able to complete this very soon, I think is credit to the hard work of everyone who has been serving on the front line. We would not have been able to do it without all their sacrifices.
Maybe I should just add to say that there is this incubation period that we always forget. Once you test the worker that is negative, if it's positive, then that's quite conclusive. Then you have to send him for care, medical care, whether it's in the community facility or in hospital, depending on the situation. But if it's tested negative, it doesn't mean that he is not infected, because you still have to quarantine him, you still have to observe him for the next 14 days. And if he's cleared after that, and you still have to test him again, because he may be asymptomatic. So he may look well, but in fact he's infected. So you have to retest him again. And if he turns out positive, then you have to go backtrace again to see when was he infected, whether there were other close contacts that you need to ring fence, you need to quarantine. So it's quite a protracted process. And therefore, I think a couple of weeks ago we did a presentation and shared the whole process of clearance of the dormitory and the workers with the media, so that there's a better understanding of how the whole system works. And it's also an opportunity to explain why sometimes it takes quite an extended period of time before we are able to finally clear everyone. We need to do that in a systematic way, a combination of isolation, serology tests, PCR tests, and a mix of them in order for us to effectively clear everyone. And at the same time, we also need to clear the dormitory to ensure that as the workers go back to the dormitories are clean. They are not infected. This way, we will make sure that they are not reinfected again after they have been cleared, and then go back if the dormitory still has infections, transmission, and then they get infected. So I think it is important for us to understand that actually it is a systematic way and quite an extensive process that we need to go through to ensure that all 300,000 workers are cleared of this infection, are able to return to work.
Thank you, Ministers and DMS. Can we have the next question from Hiai from Sao Paulo, please?
Hi, Hia from Zappa here. So my question is also regarding these foreign workers. How many of these foreign workers cases are past infections, and are there still active transmissions within the dorm? And also, can I clarify, just now it was mentioned that it's towards the end of their isolation period. This isolation period, does it refer to, since their first test when it appeared negative, so this 14 days before they did their second test, is that the isolation period that was referred to? Yeah, thank you.
The active transmission, it's very hard to distinguish, but if you use as one indicator the number of reported ARIs daily, that means anyone daily reporting sick with acute respiratory infection as an indicator of somebody who is a new infection, that number has come down significantly, right? So that's an indication that the rate of transmission of the virus is significantly slowing. Are there still new ARIs? Yes, there are, right? So it's not zero, but it's come down significantly. And when we look at the final batch of each time now when we do a sweep and we test and the final exit test, and they are positive. Many of them are asymptomatic, and we believe older infections. As to your answer about, or your question about whether when we talk about many of them are already isolated and we're talking about the tail end of isolation, we do a final exit. Whether this is the final 14-day, some of them may have had to do multiple periods of isolation. It really depends on the different circumstances they are in, right? But we're talking about indeed having served isolation period, that towards the end, we will do a final COVID test to test all of them. And as we do so, the ones who get picked up to be positive, then we will treat them accordingly. But these are the cases that we are reporting now as we finish the clearance of the remaining workers who are still in the dormitories and not cleared yet.
Thank you, Minister. Can we have the next question from Kai from Channel 8, please?
Hello, hi. Can I check, as we have seen more asymptomatic cases, so would MOH consider to put down the number of asymptomatic cases in your MOH daily situation report? This might help us to better understand the asymptomatic cases trend in Singapore and how we can take necessary action against this. Thank you.
I'll ask the DMS to elaborate. I believe we do list down the asymptomatic cases in our daily press release so that it's a total tally. And many of these asymptomatic cases, because they are asymptomatic, the patient, infected individual actually do not know that they are infected because they are normal and they feel well, there are no symptoms. So in fact, they are not likely to be the ones that are picked up by doctors. Generally, they are all right. And they are usually picked up by our proactive screening because we do regular screening of workers on the front line and so on. So we pick them up because they are asymptomatic. Despite the fact that they are asymptomatic, we do pick them up through our regular testing. And some of these cases, they end up in our hospital or in our clinics for other reasons. Some may be, say, have a fall, have a crack, and they go to our, broke their bones, and they went to our hospital, and the hospital noticed that he has ARI symptoms and decided to do a test, and we pick them up. And some may not have symptoms, but they are suspicious, so they do a test and they pick them up. So some of these are picked up through incidental findings, through our proactive screening, but asymptomatic means that they have no symptoms of any of the infection, and therefore they are not likely to be picked up from our normal screening. But we do report them as and when we pick them up through our proactive screening process. Maybe DMS can add on.
Yes, Minister, you're quite correct. The majority of cases that we're picking up right now are asymptomatic. And at the time in which they are tested, many of these are coming through our routine regular testing, as we mentioned earlier, of either frontline workers, those who are working in the construction, marine, and process settings. Perhaps in the community, I don't have the figures offhand for the dormitories, but in the community, I seem to remember a figure of about 7 in 10 of these cases being symptom-free at the time they were tested. And in fact, at least half of these, when we carry out further investigations and testing, have led us to believe that, in fact, they were old infections because they either had a positive serology test or some other features that suggested that this is likely to be old. And many of these were without symptoms. However, I hesitate to answer your question definitively because there is a difference between a person who is completely asymptomatic through his or her entire course of illness versus a person who was asymptomatic at the time he or she was tested, but perhaps a day or two later then manifests with some minor symptoms. That would perhaps be better categorized as being pre-symptomatic, or at the very least, these two groups would be symptom-free at the time they were tested. So for that category, symptom-free at the time they were tested, at least 7 out of 10 of our community cases fall into this category.
Thank you, Minister and DMS. Can we have the next question from Ishka from Bloomberg, please?
Hi, thanks for holding this briefing. I just want to understand with the resurgence of cases in many countries, how does that affect your plans for creating travel bubbles with certain jurisdictions? And what's your advisory for the entire of 2020? Should Singaporeans not be traveling at all? Thank you.
Well, the situation is dynamic and is changing very quickly, so we continue to monitor. But as of now, we are saying the travel advisory remains unchanged, which is not to travel. We don't see this changing in the near term. I can't say how it will whether or not it will be updated differently, say 3 months from now, 4 months from now, but it's very hard to predict. But what we can say, looking at the situation, is that the COVID infection around the world is unlikely to go away at the end of the year. It will continue to be with us even till next year. And in fact, at the end of the year, experts are worried about a major second wave coinciding with the flu season. So it's unlikely that we will, see a improvement in the situation in the near term, which means that our travel advisory position is unlikely to change in the near term as well. With regard to the green or fast lane discussions or negotiations we are having with different countries, we continue to continue these discussions with various countries where we assess the situation is under control. It doesn't, I think we have to be realistic too in recognizing that the situation in any country can vary from time to time. A country may have the situation well under control, today, but then later on, you may well see a flare-up because of something happening, right? A resurgence because of the behaviors of certain community groups or some lapse in control measures. This can happen to any country. So that shouldn't stop us from proceeding with the green lane negotiations, so long as the country that we are talking to has the appropriate control measures, and there are, remember, with green lane arrangements, testing in place. It's not just free for all travel. A traveler coming through on a reciprocal green lane has to abide and comply with certain control measures, including testing at point of departure, testing at point of arrival, and then following a very strict and controlled itinerary. So with these control measures in place, we generally would continue these discussions, and so long as both sides are agreeable, we will want to proceed with the reciprocal green lane as much as possible and allow essential business travel to resume in a safe and controlled manner. This will not apply to mass tourism travel, right? That, I think, will not happen anytime soon.
Okay, thank you.
Thank you, Minister. Can we have the next question from Nicholas from Yahoo, please?
Hi, this is Nicholas from Yahoo News Singapore. So it's been exactly 1 week since the election. More than 2 million people went out to vote, and there were reports about lack of gloves at polling stations and resulted in an extension of voting hours. There were also multiple instances of large crowds gathering, especially on election night. So given all this, does the MTF still believe it was safe to hold an election? And is it concerned that election clusters might emerge in a week's time?
Well, I mean, I believe the elections department did their very best to conduct the elections in a safe manner. They have recognized publicly there were areas that can be improved, and they have said that they are looking at the areas that, reviewing all of these areas. But by and large, if you look at the actual conduct of polling, and all of us were around, including members of the media, these are conducted in open spaces. The time spent in, even if you are queuing up, it's not as though there's close contact in terms of touching, talking, but people are spaced aside, spaced apart, and then you go in, you do not talk to anyone in a very prolonged manner, and then you cast your vote, and there are sanitizers provided, a whole range of different safety protocols were put in place. So I believe the elections department have done its best to put in place the safety protocols and measures for the conduct of the elections. Whether or not anything happens after this, whether there will be any case emerging, we will not know now, but if it does, we will know later, and then we will report and highlight accordingly. So I think let's not jump to the conclusion just because we see queues forming. Queues form everywhere, not just when people go and cast a vote. Queues form in F&B outlets, queues form in hawker centers, in markets, so there are queues everywhere. Right? Queuing per se is not an activity that would necessarily cause the transmission of the virus. But what we all need to do is to make sure that, once again, whether we are queuing up for something, whether we are going out to purchase something, or for any other activity that is permitted, each individual must continue to exercise responsibility for his or her actions. That's really the bottom line. If you are sick, for example, and you continue to go out, it doesn't matter whether it's for the purpose of going out to vote, or for the purpose of going out to work, or for the purpose of going out to an F&B outlet. That irresponsible action by somebody who is sick and continues to go out despite knowing that they have symptoms will lead to a cluster, potentially lead to a cluster forming, regardless of the kinds of activities they are engaging in. So I think let's have some perspective about what are the risks and why it is so important that all of us continue to exercise individual responsibility for our own behaviors.
Thank you, Minister. Can we have the next question from Cheryl from CNA, please?
Hi, good evening. I just want to ask for an update on our testing capacity. How far are we along in terms of reaching the 40,000 tests per day goal, and what is perhaps holding us back? Are we looking at a shortage of kits or a shortage of staff? Thanks.
We continue to make progress in building and expanding our capacity for testing, but we also at this time are taking an opportunity to consolidate by making sure that each of the labs has a good quality improvement process in place. We're always mindful that that the labs need to maintain a high process of good quality testing. We've had a recent incident where administrative lapses have occurred, and we are quite determined to make sure that the labs continue to review their processes and make sure that where there are opportunities for improvement, that these are properly done. So because of that, we are at a stage right now where there's a little bit of consolidation. The labs are undergoing internal review processes. Many of these labs are doing this at this time. But the capacity required for our testing needs remains safeguarded. In fact, if we look at the average numbers of tests or swabs being done through the various different strategies, including routine, regular testing, then consistently through the week, it's been somewhere in the order of about 16,000, 18,000 a day. So that's been going on. We remain on track to continue to expand our capacity steadily to make sure that we have the requirements we need, not just for the current testing needs, but also to be prepared for surges in demand that may take place if future clusters of cases recur, whether in the community, in the dorms, or in other settings as well. We also are looking at expanding our armamentarium. We continue to look at different other tests that progressively are becoming available in the market. We are also continuing to look at different other strategies. We've now adopted pool testing, but there's still room for improvement, and therefore we are looking at what other countries are doing as well, whether it's using deep throat saliva or other testing methodologies. So the important thing that we have is that we remain committed. We have a good and strong network of labs that continue to work with us. They are also committed to making sure that they provide good quality testing, and therefore they are keen to use this time to improve their processes. We are working with them, but yet at the same time, we remain committed to ensuring that the capacity we have can meet the demands that are imposed. At this time, we do not have any shortage in the test kits we need for the purposes of testing. So that's not a resource constraint.
Thank you, DMS. Can we have the next question from Ursha from TM, please?
Good evening, ministers and DMS. My question is about the consistent number of cases among work pass holders in the community. So where are they catching it from? Are they like working in the community, or have they been all the while isolated? And because many of them live in HDB flats and some in shop houses also. So is that a case of concern? And I have another clarification. It was mentioned earlier that it was a strategy to clear the dorms with fewer cases first. Did this not put more workers at risk? Because those in the dorms with higher prevalence of cases were not attended to first. Thanks.
There's a difference between testing for clearing the dorm versus testing to make sure that all people who have infections are properly looked after and treated. Indeed, those with high prevalence, those who have acute respiratory infections, presenting to doctors and medical teams, we've always remained committed to making sure they're properly looked after. And where we have people who are at particular risk of higher risk of adverse outcomes, the older workers, we've been quite vigilant to look out for them, and where we pick them up, we've been taking them out of the dorm setting, admitting them, and continue to care for them carefully. The strategy for clearing the dorms, in fact, is a very multifaceted one. We are clearing, even at the early stages, some of the dormitories with higher prevalence, but for some of the dormitories where there are smaller numbers, the dormitories vary in size from those that are more than tens of thousands of workers staying in them to those that only have in 2 digits, 20, 30 workers or even fewer. And therefore, for some of these smaller dorms, particularly with lower prevalences, it's actually not that difficult to perhaps prioritize, put them up early in the testing strategy, clearing them. So that strategy is a much more finely nuanced one that the interagency task force has been looking at. They've been fine-tuning that strategy over time, and in fact, adjust the list over time depending on how they assess, and that assessment will change as cases come out as well. So there's no one-size-fits-all approach. They've been trying to make sure that the testing strategy and the clearance strategy it fits the specific setting of the individual dorms that they are working with, but there's considerable heterogeneity in the dormitories. Got more than 2,000 different types of dorms, ranging from the purpose-built dorms to those that are in the non-purpose-built dorm settings, and therefore there's no one-size-fits-all approach. It has to be a very carefully tiered approach and appropriate to the needs. So that's what the task force has been doing.
There were another question on the work pass cases that we've picked up in the community, and why are we still picking up these cases? These are work permit holders generally, migrant workers, but who are not living in the dormitories. They are living in decanted sites. They are living in private residential properties or maybe even HDB flats. Many of them are, as we highlighted, we shared some of the statistics for this group of workers that we have picked up. Many of them are in the construction, marine and process sectors. So the likelihood is, you see, we are coming off, this is a group of, if you will, a group of workers where there was a high viral load, right, in the dormitories and including in their work sites. And despite many of them having served a 28 days stay-home notice because they were isolated for 28 days. Remember, 14 plus 14. We still, and then beyond that, we continue to do a periodic and routine testing of these workers. And even up to now, because they have just come off a very high viral load environment, both in the dormitories or in their work sites, because some of them decanted from the dormitories, and then they were working in the construction sites, being in that environment, and despite the isolation that they were being put through, even up to now, as we test them on a periodic basis, we find positive cases. And then when we find positive cases, we have to pull them aside. We do serology tests for some of them, and we find that they are indeed, many of them, older infections. Right? And that's, in a way, we are sort of looking at the tail end of coming off a very high viral load situation. This is goes back to the question of why does it take so long? Because precisely, because if you have the infection, we know that somebody who is COVID positive can still test positive weeks, even more than a month later. That person can still be picked up as positive case. So I would not be surprised at all looking at the 300,000 cases we have in the dormitories. After we have cleared all of them, right, so to speak, we will still commit to do periodic routine testing of all of these workers once every fortnight. And I would not be surprised at all that we will still pick up positive cases. And many of them may well be older infections, but it may very well happen. Just as we are seeing this for workers in the community, I think the same situation will arise later on for workers in the dormitories. And so I think we need to understand this arises partly because not all are new infections, older infections. When you have been infected, you may still test positive for COVID for quite a while. And even after isolation, as we just described, even after serving an isolation period, it's not foolproof. That's why we do a final exit test and we still pick up. And even after that, and we do the periodic 14-day test, we may well pick up older infections too. And sometimes it may well be a new infection, but that's the reason why we need to stay vigilant and have this periodic testing regime in place to make sure that even if there is a case that we had not detected before, or for some reason this person picked up the infection from somewhere, then we are able to quickly identify it later on and move in to isolate that person and the people working around him. So it simply means that we need continued vigilance around dormitories, around workers in high-risk areas like construction activities, and we just need to continue to pay attention to these areas.
I think Lawrence made a very important point that it is not possible to imagine that after we've cleared all the dormitory and the foreign workers, and there will no longer be any more cases because they're all cleared. That is not going to be the case because you will still have transmission in the community even today outside the dormitory among the Singapore local population. There is underlying transmission. That's why we are picking up cases of ARI, although the numbers are small, but they are ongoing. And therefore, there will always be risks that it will trigger another series of infection going forward. So even after clearing all the migrant workers and dormitories, you will still be picking up cases from time to time. Some of them may be old, but I'm quite sure you will still pick up new cases as well. So we have to therefore remain vigilant even after we have cleared all the dormitory cases. Basically because the virus is still present in the community in Singapore. Until we are able to have an effective vaccine that we can wipe out the virus, before that comes about, I think we have to learn to live with the virus in the community and do what we can to reduce the number of infection, to slow down the transmission so that we are able to contain the situation and control the situation.
Thank you, Ministers and DMS. Can we have the next question from Eileen from Wan Pao, please?
Hi, good evening. I would like to ask, because after GE, we are going to have a cabinet reshuffling. So will the two ministers be still leading the MTF even after if you are posted to different portfolios?
That's a preemptive question which I cannot answer today because we have not announced the cabinet lineup. But whatever it is, I think the MTF work will continue, whether it's the same minister or there'll be new ministers that will be taking over. I think we have to ensure that the work of MTF must continue, and there will be continuity even in the MTF leadership and the ministers that are involved, so that we want to make sure that the work on the MTF is not slackened as a result of change in portfolio or change of cabinet positions. So I assure you and the rest of Singapore that MTF work will continue, and we will continue to double up our effort to make sure that we are able to clear the dormitories and the migrant workers as scheduled, or even earlier if possible. And we will continue to step up on our community surveillance and proactive screening to manage the COVID-19 situation. And we'll continue to work with Singaporeans to ensure safe distancing measures are in place.
Thank you, Minister. We have now time for the last 3 questions. Can we have Stefania from Financial Times to ask their question, please?
Hello, good afternoon. I wanted to pick up on Nicholas's question about the elections. Aside from the queuing, we also saw a lot of people gathering as results were being announced with absolutely no social distancing all over Singapore. So, I mean, is it fair to say that we should expect a pickup in the number of infections? And is the task force itself bracing itself for an uptick in cases? And if you are you rolling out, any preventive measures of any kind to either avoid or try to minimize this potential increase?
Well, there were these scenes of people coming together to celebrate. Ideally, they would have practiced safe distancing. The people who were there, they know who they are. But I think the moment got the better of them, and they perhaps forgot about some of these requirements. But from the pictures I've seen, all of them were wearing masks. They may not have kept to the rule of 5. And if we can find out who they are, and we have a means to, we might be able to identify and take them to task. But I think if you look at the numbers, there are quite a number of them. And if you look at the contact that they had, I'm not sure that they were in close contact for a very long time. But in any case, whether it's that particular moment in time, one night, or whether it is, as I said, other lapses that may happen outside of that moment, it can happen in a community, it can happen anywhere in Singapore. I think it comes down to the basic point. Anytime there are lapses by any individuals, there will be a consequence, potentially. And all of us just need to remember that point, that it's very basic, right? Anytime anyone decides to abandon caution, things that it's okay, I do not need to abide by the safe distancing measures, they put themselves and they put the whole country at risk. Unfortunately, this appears to have happened in that particular incident, and I would imagine it will not be the end of it. There will be many other incidents where lapses do occur. So once again, we appeal to everyone to remember the basic fundamentals. Remember, COVID-19 is not over. Do not be complacent. Do not assume that we've got testing, we've got tracing, we've got all of these measures, and therefore it's okay. We only need to look at the evidence around the world, and that's why we've also highlighted what is happening now in many other countries where they had successfully controlled the virus, but due to a whole range of lapses with regard to safe distancing by individuals or by different groups, they see a major resurgence of the virus. We would like very much to avoid this outcome. We are trying our very best in the task force, in the government, all the officials are all out trying their very best to enforce the rules, to identify early any case, and then to ring fence and contain and isolate any suspect cases. But we cannot do it by our own. We need everyone to cooperate, and that's why it is so important that every Singaporean, everyone does their part.
I will point out that we've been keeping a very close watch on the numbers of cases that come on a daily basis. We've been doing this for quite a while. When we moved from the circuit breaker to phase 1, I was keeping a close eye to make sure that there would not be an increased number of cases as we transited into allowing some resumption of activities in the community. I continued to be vigilant about this when we moved from phase 1 to phase 2, and therefore it's still a concern for me that the numbers of cases may rise in the community. I'm not focused entirely just on a GE or post-GE setting. There are many other opportunities where just a breach in the safe distancing, safe management rules, if people are complacent and they lose their discipline, we can easily see clusters form. And this has been the case ever since we moved towards into phase 2 with many other activities occurring. We've seen already some cases where there have been people who have not followed those rules, whether it's playing badminton, gathering in larger groups. And we continue to remind all Singaporeans and residents to please play your part, be socially responsible, wear your mask, keep your distance, protect the more senior people we have in our community, in our families. Try to keep your visiting and your movements outside the home to a minimum. Where possible, try to work from home. The entire situation of having more cases in the community can be mitigated if everyone does his part. But from the public healthcare system point of view, we will continue to be vigilant. We have stepped down some of our facilities and resources because our numbers have come down, but they are not taken out of service. They remain in reserve. They can easily be stepped up if we need to, if the cases in the community rise again. And therefore, this is something we will continue to track and monitor through the days, through the weeks ahead.
I should add that I shared with all of you the few charts just now about the different regions seeing a second wave. And those second wave are not a result of any election in those regions. And second wave do occur and can occur regardless of whether or not there's an election. What is important is each and every one of us play our part to remain vigilant, even now and going forward. Never let our guards down, because today numbers are low and we decide to celebrate and relax. I think that would be the biggest mistake. So we must continue to remain vigilant, and every effort counts. Because if you look into the study into detail of the cases that I mentioned earlier, some examples I gave, one or two single incidents can spark off 100 cases, a big cluster. And we have seen that in our SAFRA and so on clusters. So therefore, we have to do our bit and to try our level best to contribute to this effort of controlling COVID-19. So every bit of effort will count towards this ultimate outcome. So I urge everyone to work with us, to exercise caution, to be serious about safe distancing, keep ourselves safe, and keep our family members and our friends safe.
Thank you, Ministers and DMS. Can we have the next question from Claudia from Business Times, please?
Hi, good evening. My question is, so what is the threshold of average weekly community cases before the task force will actually consider tightening existing safe distancing measures? And also, do you foresee a prolonged phase 2 going into Q4? Thanks.
So far, our number of community cases have remained low, as I explained, and we are looking not just at the absolute number. Of course, if the numbers are low, then it assures us that our safe distancing measures are effective and we can continue our journey of this phase 2 opening, and hopefully in time to come we will reach phase 3. But if the numbers go up, rather than a hard threshold beyond which we trigger another circuit breaker or below which we just remain happy. But when the numbers go up, we do need to look at the nature of the numbers. That's why I gave a quite extensive explanation of the community numbers just now to explain that the different categories of numbers that we are looking at, whether or not they give us an early signal of this rising transmission in the community. And that is so, then we will be alerted and then we need to react. And how we react also depends on the nature of the transmission. And so far, as I mentioned, many of our community cases are related to construction or related activities, and therefore we continue to be quite vigilant and quite tight in our control of construction activities, including regular testing and screening of workers who are in the construction sector. So this is how we will apply very targeted measures. Even as the numbers stay low, as Minister Wong mentioned, we are now adjusting our border control measures, our SHN measures for specific selected regions and countries, so as to ensure that the risk of imported cases are reduced. So even at the low level of community cases, we will continue to monitor and adjust our measures as we go along. And these measures are likely to be more targeted, and we hope that we don't have to reintroduce a broad-based circuit breaker like we have done before, and more likely to be very specific measures targeted at specific areas where we identify as high-risk areas or activities. One example, as I mentioned, is construction sector, which we continue to tighten and continue to monitor and to make sure that we do not have a problem in the construction sector.
Basically, we will try our very best through a whole range of measures not to have to go to another broad-based circuit breaker or lockdown for the whole of Singapore. We want to avoid that. We don't know if we can achieve that outcome, but I believe if everyone cooperates and through the enhanced capabilities that we have now for testing and tracing, we will be able to do it. But again, it cannot be done by the government alone. Everyone must do their part. I can appreciate that there is some fatigue with the measures. It happens everywhere in the world. It is very hard to say, you have to limit to your contacts to a certain number of people, you have to keep wearing a mask every day, and you have to restrain from all the usual things that you would like to do. I can appreciate that there is a fair bit of fatigue out there, and this happens everywhere. But really, it comes down to all of us staying disciplined, being vigilant, and recognizing how real the risks are, even today. So if we all maintain and do our part, then through all that we have described, the ability to go in quickly, do very aggressive testing and tracing, we can also go in quickly to do localized restrictions, like shutting down premises where we believe might be of higher risk, or putting in place local control measures. And then we might be able to maintain on this path of phase 2 for a while without having to without having to activate another circuit breaker. Through these local control measures, we could keep the infection under control. And if we have confidence, we might progressively, as we have said, allow some easing within phase 2. Not immediately, but we monitor the situation over the coming weeks or months, some easing around the number of people who can gather together, the number of people who might be able to, for places of worship, for example. So we might consider some of these moves for duration of phase 2. But as we have said before, phase 2 is likely to last for months. That means we are still in the early stages of phase 2, so we should expect quite a bit more time to continue in phase 2 in this sort of environment where we have a whole range of control measures in place before we can even think about what it might be, what phase 3 might be. One of the questions all of us get asked a lot is, when will phase 3 happen? and again, we need to mentally prepare ourselves. Phase 3 is not going to happen anytime soon. Right? Within phase 2, we will be able to relax some measures if we all do our part and cooperate. But again, that's not a given. We may have to also apply a few more restrictions if the need arises, as we are doing today for the border measures. We have just tightened up for a few places the SHN requirement. So we will be in this situation where we assess the risks, apply new restrictions from time to time, perhaps also allow for some relaxation. But with all of this, hopefully we can avoid another circuit breaker. But at the same time, we should be prepared that it will not be live as what it was before the circuit breaker. We are not going back to life before the circuit breaker anytime soon.
Thank you, ministers. Can we have the final question from Pei Ting from Today, please?
Hi, this is Pei Ting from Today. Could you address if there has been a change of stance in enforcement, seeing that like some enforcement officers might be present in like, let's say, when there were large crowds after the results were announced, and seeing that some of them might have taken a step back in taking action? Had there been a change in the stance of enforcement?
There is no change in stance of enforcement. In fact, the enforcement officers are will continue to be deployed, and they will, including the safe distancing ambassadors, and they will continue to take action as and when necessary. But again, once again, we must appeal to everyone's, every individual must have that basic understanding. No amount of enforcement can work if the whole country wants to go for a celebration. How? What amount of enforcement will be effective if everyone is in a celebratory mood and wants to go out and have a big party? It's not possible. So enforcement is important, measures are important, but individual responsibility is key and crucial. So again, let's keep it may sound like a broken record, but we really need to remind everyone, yes, it's so easy for us to lapse into some of these behaviors because it really requires discipline and control. But let's just remind each other, let's continue, and leaders or influential people who are influencers in their respective communities ought to take that leadership role as well, reminding their own followers, reminding their people that they can influence, that these are important actions that everyone has to, remind everyone that these are important steps that they have to take. Don't just rely on the enforcement officer coming in to, issue you a penalty. If we can all do that, then yes, the enforcement will be there, the rules are there, but all of us doing our part, we will have a good chance of avoiding another circuit breaker. We will have a good chance of keeping the infection under control and allowing our economy and society to reopen progressively and safely.